A new report shows the demand for healthcare workers such as nurses and lab technicians is increasing rapidly.
News 8's Eric Jacobson now joins us from the newsroom with a look at how local hospitals are responding.
Martha and Mike, the report, which comes from the Wisconsin Hospital Association, shows that vacancy rates among registered nurses and certified nursing assistants have doubled since 2012. It also shows that a little more than 40% of Wisconsin nurses have indicated that they will retire within 10 years. It's a problem local hospitals are trying to overcome.
I've always had a passion for caring for people.
Crystal Carter has been a registered nurse at Mayo Clinic Health System since February.
Helping people when they're at their worst moments is really the biggest thing, and being able to be that support person for them and help them get through it.
But officials at Mayo say nurses like Carter will become more important in the years to come.
It's a perfect storm, as they would say, but I think one of the bigger changes in the next five years or so is the growing number of people retiring.
Compounding the issue is the job turnover in the nursing industry.
It might be a hospital nurse going to a clinic or a hospital nurse going into public health. And that's what we call the churn. And we're seeing that in our region, in our hospital locally here.
Officials say the solution to getting nursing students to stay in their hospital job is to get them into a hospital position sooner.
We did a pilot and it's very successful on our 7th medical floor where we created a dedicated education unit. We know if we can get them in the door and try us out, that we can retain a higher proportion of students coming from our 3 main facilities here.
Once there, officials say it's about keeping those employees happy.
Having incentives, things like tuition reimbursement, encouraging them to go back to school, making sure they're in the right fit for their job.
Carter says with the support she's received, she doesn't plan on going anywhere.
I know Mayo also offers bonuses and pay increases quite frequently, so that also, is an incentive to really want to work here and stay here, and you feel appreciated. And I think that's most important.
Now, officials at Mayo say it's the specialized job, like surgical technicians and neonatal intensive care unit nurses, are the jobs that are in most demand now. What's making the shortage worse, however, is the fact that the general population is getting older and needing more and more medical care.
All right, thanks a lot, Eric. And if you would like to read the full report for yourself, we do have a link up on our website, news8000.com.